Yes, you're welcome. It's your boy Jacob. Now, in this video, I'm going to talk about 5 medical courses with low market values. Those courses which are low on demand and those which you should really avoid. If you are a student out there, you are a secondary student, and you want to do some of our medical courses, there are courses which I would advise you should avoid. And when you do these courses, you are really going to struggle to get a job. So it's my job here to enlighten you on some of these courses which you should really avoid and take on other courses which are on demand. So one of the courses you should really avoid selecting when you want to do some of our medical courses is physiotherapy. Now, physiotherapy is a great course, a great career, but the demand for this course is very low. Let me give you an example. Most hospitals take only one physiotherapist. Now, at most two. Nakasero would take one, Mengo would take one, Rubaga one, and if there are 20 hospitals in the country, that means those are 20 physiotherapists, period, and all of them are not going to leave their jobs any sooner. So where are you going to get a job as a physiotherapist? So the demand for physiotherapy is quite low, and I believe you should avoid this course unless your job is guaranteed somewhere or you are going outside to perform or work as a physiotherapist. But this job, the job for a physiotherapist, either diploma or degree, the demand is really very low. Another job I would say you should avoid is orthopedic medicine. Yes, orthopedic medicine at diploma level, the demand is really very low. So if you're a student out there, senior 6 secondary student, certificate level, you want to do orthopedic medicine at the diploma level, I would advise you to choose another course to take. Please don't take orthopedic medicine because the demand for orthopedic medicine is low. I can give you an example. All these hospitals in Kampala, none of them is hiring orthopedic medicine unless you are going for a government position. But if you are not going for a government position, please don't select orthopedic medicine because most of the things they do, they are done by their surgeons, the orthopedic surgeons at a master's level. But at diploma level, the jobs are really very less. There are no jobs in private facilities unless you are guaranteed for a job in a public facility. Please don't take orthopedic medicine. You'll flop with it and you will not get a job. A third course I would tell you to avoid is medical records. Yes, a diploma in medical records or a certificate, please avoid it. There are no jobs for that. Most hospitals will take only one person with medical records, and if you are like 100 in the studying this course, there is no jobs for medical records unless you are guaranteed a position in a government facility. The jobs for medical records assistants, they are really very less. So you should avoid some of these courses. There are more popular courses which you can take. You can check out on some of my videos where I mentioned the high most demand medical courses which you can choose and you are guaranteed a job. Now, another fourth course you should avoid is dispenser diploma in pharmacy. Now, diploma in pharmacy might sound to be a very good job, but the problem with it that most of the jobs are for the pharmacists at a degree level. So when you do a diploma in pharmacy, you are mostly as a dispenser, and the things you would do, most of your bosses, the pharmacists, are doing them. So the job market for diploma in pharmacy is also very, very low. Not so many hospitals are hiring them. So this diploma, unless you are going to do a degree in pharmacy, and that's the reason you are taking up this course, I would agree you would go ahead and do it. But just doing a plain diploma in pharmacy is not very marketable. Another fifth course I would recommend you not to take is a diploma in clinical medicine. Way back, clinical medicine was doing very well because the doctors were less, but now the doctors are flooded and each hospital is hiring medical doctor and they are not hiring clinical officers, because whatever clinical officers can do, the medical officers can do better. And the number of universities pouring medical officers, there are so many, so the demand for clinical officers has lessened. So please, I would request you to avoid taking clinical medicine because their demand is low. You are going to flop getting a job. You are really going to struggle. Unless your aim is to go and do medicine, please avoid clinical medicine because its demand is low. Most of the jobs for clinical officers are taken up by medical officers, who are so many. So these are 5 courses which you should avoid to take. Their demand is low and their market is low here in Uganda. So please make a comment in the comment section. Tell me what some of those courses you should avoid which I have not mentioned, and let me know about your feelings about my video, whether you disagree with me or you agree with me.